our final speaker today is Dr. Lisa Wong, who is the director of the LA County Department of Mental Health since February 28th, 2023, after serving as interim director. Prior to this role, Dr. Wong was LA County's Senior Deputy Director overseeing their department's clinical programs and community-based services over a broad range of setting throughout LA County. She started her career actually with LA County while she was still in school as a student 30 years ago. So she's really worked in a lot of the departments within the county. She spent 2 decades working in the Skid Row area, providing care to some of the county's most vulnerable and high-risk individuals experience serious mental illness and homelessness. Prior to that role, she served as the mental health clinical program head over Downtown Mental Health Center General Outpatient Services. Dr. Wong also earned her psych degree from the Pacifica Graduate Institute and her MA in clinical psychology from California State University, LA. And she is a lifelong advocate of vulnerable populations and social justice issues. Please join me in welcoming Dr. Wong.
Thank you, Trouty. Actually, I don't have a talk. I was supposed to do a welcome, and I'm so glad to see you. So you'll get to go get coffee soon. But I just want to say good morning, everyone. I'm Dr. Lisa Wong and the director of the LA County Department of Mental Health. And I have to say, it's so wonderful to see all of you here today. And such a pleasure to be here, to be a part of NAMI Greater LA County Conference. And this year's conference theme, Together Again for Mental Health, I think is so apropos. I love that theme because I think we can all agree how wonderful it is to actually come together and, be here together and have this wonderful conference. And from what I can see on today's agenda, organizers for NAMI Greater LA have a lot in store for you throughout the day. We already heard from 2 of our esteemed speakers, Dr. Mark Galley, the Secretary of the California Health and Human Services, and also Lisa Gomez, who I had the pleasure of meeting with just a couple months ago, Assistant Secretary of U.S. Department of Labor, EBSA. Now, I tell people what EBSA is. And, so important for people to know because as families, as loved ones struggling to take care of our people, we need to have as many resources available to us as possible. And sometimes in the Department of Mental Health, that's one of the most heartbreaking things to me. I know about all the amazing programs they have, all the really dedicated people, and then I go out in the public and I find these things are not known to everybody, and access that I think might be easy is not easy to everybody. So I think we have a lot to do to get the word out there, share the resources, how they can be accessed. And doesn't matter what kind of parity we fund if functionally it is not a system of parity. So I think that needs to be one of our goals. As mental health professionals, peers, family members, and advocates, our focus has always been on mental health issues and helping people live their best lives. But now, I think post-pandemic, we really see a shift in perspective. There's a much broader recognition in our communities, in society, of how important one's mental health truly is, and how imperative it is to help those who are most in need and most at risk. I mean, it seems almost like everything nowadays has to do with mental health. We went from like 0 to 100, right? Now we have, Care Court. We have early implementation of Care Court. In fact, we have our emergency declaration for homelessness. We have our depopulation of the jails. We have all these different initiatives, not to mention Prop 1 coming up on the ballot, that have to do with caring for people with serious mental illness. And we're at a point where so many others are finally able to see what we have seen all along, that mental health is health, that mental health is a social justice issue. And the need for mental health services and support today is greater than ever. Your tireless advocacy and actions have helped us to get where we are today. It has been a long journey and it's not over yet. But you have really helped to make all of this possible, the progress that we have made. I thank you and I applaud all of you in this room and beyond for always speaking up, doing the right thing, even when it's not popular, even when nobody wants to hear it. Because you do it for the right reasons. You do it because you see the person at the other end of this. You see the person who needs the help, who needs the resources, who has been suffering. And you know that within our hands is the opportunity to change the trajectory of this person's life. So today, I hope you have the opportunity to make meaningful connections and learn even more ways we can continue to move the needle forward. Your voice, your support, partnership are all keys to the success that we can create together and implement for individuals, families, and the communities that we serve. Have a wonderful day of learning and connection, and I hope that you will leave this conference energized, inspired, and hopeful. Thank you.